Hello, all. Welcome y'all to Vedora, the aura of knowledge, the radiance of wisdom. So, starting with the first chapter of Ashtanga Hridayam Sutra sthana, AYUSHKAMIYA Adhyaya, the chapter pertaining to longevity of life. This chapter begins with a prayer, Ragadi Rogan, which is actually a tribute for the forefathers of Ayurveda. Now, coming to the main concepts of this chapter, initially the Acharya describes the Purusharthas, which is the objectives of life. He states four objectives. Let's go through it. Ayuhu kamaya manena dharmartha shuka sadhanam. Ayurveda upadesheshu videyaha paramadaraha. So the Chaturveda Purusharthas are Dharma, Artha, Kama and Moksha. Dharma is the righteous things to be done. For what? To earn the artha. Artha is the wealth. And kama are the righteous desires, and that also should be in a dharma way. By this, we can attain moksha, which is the final aim of our life. Coming to Ayurveda Avatarana, the origin of Ayurveda. The shloka goes like this: Brahma smitva ayusho vedam prajapatim majigrahat. So ashvino tav sahasraksham, so atriputradi kanmunim. Te agniveshadi kamste tu pritak tantrani tenire. So Ayurveda was actually not told by Brahma, it was just remembered by Brahma, which says that Ayurveda was already there. So just Brahma remembered it and he told it to Daksha Prajapati, the ruler. And then Daksha Prajapati has taught this to Ashwini Kumaras, the twins. And then Sahasraksham here refers to Indra. Sahasraksham is the one who has 1,000 eyes. Then so Atriputradi Kanmunim. Atreya Punarvasu is the Atriputra here. And this from Indra it has passed to Atreya Punarvasu. And coming to next, it has passed to Agniveshadi Kamste is the disciples of Atreya Punarvasu, Agnivesha and his Shishayas. It goes on. So like this is the Ayurveda Avatarana according to Vagbhatacharya. Coming to the Angas of Ayurveda, we have Ashtangas. It goes like Kaya Bala Graha Urdvanga Shalya Damshtra Jara Vrishan Ashtavangani Tasyahus Chikitsa Eshu Shamshrita. So Kaya Chikitsa refers to the general medicine for normal cold or any other normal diseases. We just initially refer to the Kaya Chikitsa department. Next, going to Bala Chikitsa, it is about the pediatrics. Generally, the children below age of 18 are considered under this category. Next, Graha Chikitsa is the psychological treatment where we include the nakshatras, all those things. And Urdhvanga Chikitsa is ENT about the clavicle region. And Shalya Chikitsa is surgery which was mainly dealt by Shushrutacharya in Ayurveda. Damshtra Chikitsa is toxicology which deals with the visha and the poisonous venoms and all. Jara Chikitsa is the geriatric medicine and the rejuvenation therapies and all comes under this like Vajikarana and all. And Vrishan Chikitsa is aphrodisiac, infertility treatment, mainly dealing about the reproductive health. Next, passing on to the next concept is the Tridoshas. So here, Acharya Vagbhata has beautifully explained this concept in a way of correlating the Tridoshas with the location, its time of predominance, the Agni, the Koshta, the Prakriti, and various factors. So let us refer it one by one. So here, three doshas are Vayuhu Pittam Kafascheti Trayo doshaha Samasataha Vikrita Avikrita Deham Gnantite Vartayanti Cha. So here, the three doshas mentioned are Vata, Pitta, Kapha. According to all acharyas in Ayurveda, we have just three doshas. And these three doshas, they in their Vikrita or in avikrita avastha. If they are in vikrita avastha, they construct our body frame. Whereas if they are in avikrita avastha, they destruct our body. This is what is told in the second line. Next, going to the site of the tridoshas in our body, ते व्यापिनो अपि हृन्नाभ्यो अधो मध्य ऊर्ध्व संश्रयाः. So again, vata, pitta and kapha. It is divided into adaha sharir, means the lower region of our body, maybe our legs. It is for the vata dosha. It is actually told it is below the pakvashaya level. It is for vata dosha. And pitta dosha is from the clavicle to the pakvashaya level, that is madhya sharir. So that is ruled by the pitta dosha. And kapha, it is located in the urdhva sharir. But it does not mean that they are placed in this position. No, that is not the understanding. It is like their predominance is more in this region. Okay, so next coming to the dosha predominance. वयो अहो रात्रिभुक्तानां ते अंतर्मध्यादिगाः क्रमात्. So this sloka says a beautiful concept like vata, pitta, kapha. Take it in any perspective. The initial things become the vata, the mid one is the pitta, and kapha will be the later one. So let's see. Day. Evening is vata, pitta is the mid one, and kapha is the morning one. So initially kapha, mid is pitta, and the later one is vata. As from top to bottom in our body it is characterized, same way in anything you take. Like see here, initially it is mentioned the day. Morning it is kapha, and mid it is pitta, and evening it is vata. Even in night, early night is kapha, midnight is pitta, and late night is vata. Age, if you take, childhood is kapha, the youth, the adolescent period is pitta, and when you become old aged, you are vata category. So in these people you can see more vata disorders like joint pains and all. Next, in food also, the gastric phase is kapha, and in intestinal phase it is pitta ruling, and colonic phase it is vata. So this is how the three doshas plays an important role in our sharira. Coming to dosha and agni comparison. So tair bhavet vishama tikshno mandascha agnihi samaihi samaha. So here actually, Acharya has told four koshta, Agnis here. Vata, Pitta, Kapha, Samadosha. These rule four types of Agni. Vata has a Vishama Agni, means the one with Vata disorder will have a Vishama Agni who can easily digest whatever heavy foods you give, they can easily digest it. Next, Pitta, it has Tikshna Agni, somewhat mild digestive power. And kapha, it is mandagni. If you have to only give light food to get digested, even light food will take some difficulty in digesting in kapha prakriti person. Coming to samadosha. Samadosha is the equilibrium of all the three doshas. They are in their perfect ratio. So that time the samagnis, they, it is called as samagni. Next is dosha and koshta. कोष्ठः क्रूरो मृदुर्मध्यो मध्यः स्यातैः समैरपि. So vata, pitta, kapha. Here vata is krura koshta, pitta is mridu koshta, kapha is madhyama koshta. Doshas and prakritis. So here this is actually a shloka for origin of prakriti also, which will be referred in Kriya Sharir, Prakriti chapter. So here, Shukra Artavasthair Janmado Visheneva Vishakrimaihi Kaischa Tistraha Prakritayor Hina Matya Uttamaha Pritak Samadatu Samastashu Shreshta Nindya Dvidosha Jaha. So, Shukra and Artava. the semen, that is the Shukra is the semen, the male gamete, and Artava is the ovum, the female gamete. When it is fertilizing, Shukrartavaste Janmadav. Visheneva Vishakramahi. Janmadav is giving a birth. So Visheneva Vishakramahi. The venom of a snake is not harmful to itself. Like that, the dosha which is formed during the fertilization is not harmful to the fetus at that time. तैश्च तिस्त्रः प्रकृतयो हीनमध्य उत्तमाः पृथक्. So here we have three. Hina, Madhya, Uttama, Prakriti. What is Hina Prakriti? The one who is having Vata Prakriti is considered as Hina. And Madhya is Pitta Prakriti. Uttama Prakriti is Kapha Prakriti. समधातु समस्ताशु श्रेष्ठ निंद्य द्विदोष जाह. Sama Prakriti is Shrestha and Nindya is Dvidosha Prakriti. So, the most undesired Prakriti would be Vata and somewhat tolerable is Pitta Prakriti. Kapha Prakriti is Uttama Prakriti. When you have the Sama Prakriti, that is all the three doshas are in an equal proportion, then it is a Shrestha Prakriti. And when two doshas are involved in the determination of Prakriti, then it is Nindya. Next, going to the gunas of the doshas. Vata doshas has Ruksha Lagu Sheetakara Sukshmaschalo Anilaha. So here, Ruksha is the dryness. So a Vatic person will actually have a dry skin, all those things. And Sheeta, when you feel cold in Sparsha. Next, Lagu, they are light as wind. Okay? And Kara, rough. That roughness could be again felt. Sukshma, subtle. That penetrating effect will be more, where air is omnipresent, like that. Chala, it is mobile, it keeps moving. So here for Vata, just remember air as simplified in the image. Next, coming to Pitta Prakriti. Pittam sasneha tikshna ushnam lagu viracham saram dravam. So sasneham, it is not fully oily, a bit oil. Okay, not as snigdha. It is sasneha. Sasneha is a little oily, not much oily. Next is tikshna. It is sharp. Means the effect of it is so strong. They say. Ushna. Hot it is. Lagu. Viratra. Sara. Lagu is light. Viratra is the spreading property. So Pittam means the fire. You remember the fire, which actually spreads. And it is light as it is Urdhvagati. It is having a Urdhvagati. And fire is hot, as we know. And Sara. Sara means it keeps flowing. Okay. And Dravam. Dravam means it is liquid in nature, like that. Now, coming to Kapha. Snigdha Shito Gurur Mandaha Slakshna Mritsnaha Stiraha Kapha. So, Snigdha is the oiliness. Here you can imagine Grita, ghee for that instant. Next, Shita is the cold thing. Guru, heavy it is. Manda, slow. Slakshna, smooth. Mritsna, stable. Stira is stable. Next, uh, passing on to the next topic, it is about the samsarga and sannipata dosha. So here, actually, this concept is important for you in next year, that is in your second profession. So samsarga sannipata diseases we have. So samsarga means when two doshas combine, that forms samsarga. Sannipata is all the three doshas combined together. So samsarga like vata pitta, vata kapha, pitta kapha and all. And sannipata is vata pitta kapha, all three together. Coming to dhatus and malas. रसासृक् मांस मेदो अस्ति मज्ज शुक्राणि धातवः सप्तदुष्यः मलाः मूत्रशकृत् स्वेदादयो अपि च. So this again you have it in your physiology. Saptadhatus and Trimalas. You will be dealing it in detail. This is just a reference. It is better if you learn this shloka now itself. So rasa is the rasa dhatu, the first dhatu, poshaka dhatu. Ashrik is rakta, the blood. But you cannot correlate the Ayurvedic term as it is to modern term. But just for your understanding, I'm telling it like that. Mamsa, Meda, Asti, Majja, Shukra are these things. So Mamsa here says the muscles, tendons and all. Meda is the adipose tissue. Asti is bone. Majja is the bone marrow. And Shukra is the semen. And Malas you have Mutra, Purisha and Sveda. Urine, feces and sweat. Now, how to manage this samsarga sannipadam? Vriddik samanaihi sarvesham viparitair viparyaha. So this is a general rule. To manage something, what you should do. So, as an Ayurvedic students, we have to know something. The gunas of tridoshas. And you have to know when you go for pathology, you have to know that this disease is having this type of dosha influence. So the medicine which you are going to prescribe should be opposite to that of that dosha guna. So that is what is told in this shloka. If it is a vatic disorder, you will not prescribe a medicine which is going to aggravate the vata. Instead, it should subside the vata. So it should be of the opposite qualities. That is called viparitam here. So that will do the shamana of doshas. Next, coming to rasas. In Ayurveda, we have shat rasas. रसः स्वादु अम्ल लवण तिक्त उष्ण कषायकाः षड्द्रव्यम् आश्रितस्ते च यथा पूर्वं बलावहाः. So here swadu is also called as madura rasa, the sweet taste which is pleasing for us. Next is amla rasa. It is sour. Lavanarasa, salty. Tikta is bitter. Ushna and Katu is spicy, and the sixth one is Kashaya, astringent. And if you see that it is having a krama in the sense it is an order. So Swadu Amla Lavana Tikta Ushana Kashaya, it actually has a krama like Madura is the strongest rasa, means it promotes the body strength, nourishes the body, it is tarpana, vardaka, all those things. And next comes amla, then lavana, then tikta, katu, and kashaya. But each one is having its own qualities, but then madura is considered the superior one. Coming to rasa and the dosha, तत्रागा मारुतं ग्रन्थि त्रयस्तिक्तादायः कफं कषायतिक्तमधुराः पित्तमन्येतु कुर्वते. So I have a trick for this. So Kafakara and Vatahara is Madura Amla Lavana. Just remember, first three are for Vata. Okay, for Vata dosha, to decrease Vata dosha. Madura Amla Lavana is for decreasing the Vata dosha. The last three, Tikta Katu Kashaya is for Kapha dosha, to decrease Kapha. Then what about Pitta? Just remember KTM bike. Okay, KTM. Kashaya, Tikta, Madura. You will never forget. So to decrease Pitta, you need KTM bike. Kashaya, Tikta, Madura. Okay, and if you see Vatahara, Kafahara, they have an opposite qualities. So if it is Vatahara, it will be of course Kafa Kara. Kara means increasing, which is promoting Kafa. And which is Kafahara, it is Vata Kara. Again, it is promoting Vata. So like this, you can remember it. You won't forget. Next is Dravya Beda. Shamanam Kopanam Swastahritam Davyamidi Trida. So here we have three types of dravyas: Shamana, Kopana, Swastahita. Shamana is the one which pacifies the aggravated doshas. Kopanam is the one which is balancing the dhatus, which is promoting the dhatus to be in a healthy state. And Swasthahitam is the one which does both the things simultaneously to lead our healthy life perfectly. And the dravyas, you will be learning it again in your second profession. Next is Virya and Vipaka Beda. Virya is, we have two Viryas mentioned here. Ushna Shita Guna Utkarsha Tatra Viryam Dvida Smritam. So Ushna Virya, Shita Virya. This is the two classification. So Ushna Virya, actually it is Tapavardaka, Deepana and Pachana, which increases your hunger and digestion, also the metabolism. Next is Pachana Shakti Vardaka. It helps in easy assimilation also. Srotoke Lokena Vala. Next is examples of this may be Shunti, Maricha, that is ginger, pepper, Pippali. Again, it is a type of Maricha again. All these things. Next, coming to Shita. Shita is cold. Okay. So, Shita Virya. It is Shitala Daha Shamaka. Means it reduces the burning sensation, it reduces the thirst, and it reduces pitta also. Okay. That burning sensation is due to pitta. So, it will shamana. It does shamana of pitta. So example of cool things is like mint, Danya is mint actually. Then Ushira, Chandana, Kamala, all these things are example of Shita. Next coming to Vipaka, we have three Vipakas. Trida Vipako, Dravyasya Swadu Amla Katukatmakaha. So what is Vipaka actually? Vipaka is the end metabolic product in each stage. So we have three stages of digestion. That the first stage is Madhura Vipaka, Amla Vipaka, and Katu Vipaka. Here, if you take Madhura and Lavana Vipaka comes in Madhura Vipaka. Rasa. Madhura Rasa, Lavana Rasa comes in Madhura Vipaka. Amla Rasa in Amla Vipaka. Katu Tikta Kashaya in Katu Vipaka. Now, this Svadu Vipaka is Brahmana, Poshana, Balya, Shukakara. Amla is Deepaniya, Ruchikara, Pachana, Snehavardaka. Katu is Langana, Shoshana, Stambana, Kafapitta, Shamaka. So to be simple, Svadu Vipaka, that is Madhura Vipaka, is actually promoting the bulk of the body. Amla Vipaka, it helps in digestion, promotes the taste sensation, and it helps in assimilation. Katu Vipaka is the one which does shoshana, which creates drying up of the excessive fat, bad cholesterols and all. So this is the basic things of Virya and Vipaka. Next, going to the major thing. So this is something which you have to by heart right now itself. Vimshati Gunas. So just listen. Vimshati Guna is like the gunas of the Sharira. Guruvadi Gunas it is called as, or Dvandva Gunas, as I'll give you the justification. Like Vimshati is 20 number, so there are 20 number. Guruvadi means Guru and etc. Gunas. Dvandva Gunas means it is having an opposite guna to it. Okay, actually here Vagpata has mentioned only 10 gunas. The next 10 are untold. It is being hidden in the shlokas. So that is the opposite guna of the told 10. Next is Sharirika Gunas. These gunas are in our Sharira. So this is called as Sharirika Gunas. Now Guru. Guru does Brahmana Karma, that is nourishing and increasing body mass. So if you learn it now, it will be helpful for you in PV and also in your next year. Okay. So Guru does Brahmana, means it is bulk promoting. Okay. Next is Lagu. This is opposite. Guru is opposite to Lagu. So likewise I have written it. You can understand. So Langana. Langana is the one which creates emaciation, which gives lightness to your body, easy digestion. Next, Manda is a slow metabolism, which slows the processes in your body, is Manda. Like Shamana, it does Shamana. Shamana, Shodhana is there. Shamana is the one which pacifies, which slows, reduces the intensity. Next is Tikshna. So this is Shodhana. It does Deepana Bedana. No, it enhances the digestion. It is having a penetrating effect. Shita does Stambana. Pitta Shamana also it does. Means it subsides the aggravated Pitta. Next is it is cooling, reduces the burning. Next, Ushna. Ushna is Deepana. Svedana is the main karma of it, and it is Vata Kapha Hara. Next is Snigdha. Snehana Vatahara Snigdha. It is actually Kleda is the karma of it. Rukshana, it is Shoshana karma. Slakshna, Aropana karma. Kara, Lekana, scrapping, it removes the excessive things. So the scrapping action is needed in which sort of things? Where you have to remove something which is sedimented. Say in atherosclerosis, all these things, you need this. Next is Sandra. Sandra which solidifies. Ridikarana it does. Next is Drava. Vilodana which makes it to just move, liquefy something. Next is Mridu Karma. Mridu is Mardava, Virechana, Anukula. Softens the tissues. It creates Shitilata, looseness. Katina, Dridata, Sangata, hardens and provides firmness. Stira, this is giving dharana. Stira means it is giving us strength or support to the body. So dharana, stambana. It stabilizes and prevents the movement. So stira guna is important while you move or when you stand. It gives you a postural thing. Sara. It is anulomana pravartana. It is prasarana is its karma, which keeps moving or flowing. Sukshma. Sukshma is vyavai, which can penetrate even in a small pores. Next is Stula. Avarana Brahmana, which is bulky and channel covering nourishing thing. Vishada is the one which promotes Kleda Shoshana. Shoshana is its karma. Clarifying one. Pichila is lepana. Like for pichila, you can just remember a mask. It is a protective coating or binding thing like that. Next topic is about Nidana of Roga and Arogya. So this is also a very important concept which is to be followed even by us. Kalartha karmanam yogo हीनमित्यति मात्रकाः सम्यक् योगश्च विज्ञेयो roga arogyakha karanam. So kala artha karma. Here kala is the time. Artha is the objects. Karma is the actions. So the kala means I'll give you example after explaining this concept. Yogo hina mitya atimatrakaha. When you use it them in hina mitya atimatra. Hina means in a very less amount or mitya means in a wrong amount. Ati yoga means in a excess way. So this use of these three things. Samyak yogascha vigneyo roga arogyaka karanam. So this is actually the one which determines the healthy and unhealthy state of us. So for example, just um, let's take consider an example of phone, using a phone. So kala artha karma. Kala is the amount of time you spend on it. Artha is the object. The object here is the indriyartha. So your eyes. Karma. What you do? You just watch the screen. So here, if you are doing Hina yoga of this, You just don't expose your eyes to light itself. You keep on sleeping or you're under a dark room. That is also a wrong thing. What you're doing to your artha, that is the eye, chakshurindriya. Next is mithya. Mithya is either you're keeping your phone too close to your eyes, okay, or to a high brightness thing or a very dim one. That is mithya yoga, when you're using your indriya in a wrong way. Ati yoga is for hours and hours you keep scrolling reels. So that is Ati yoga of Kala, Artha and Karma. So this is how you have to understand this concept. Next is Roga. Okay. So Rogastu dosha vaishamyam, dosha samyam arogata. So the definition of Roga and Arogya is Roga is the dosha vaishamyam. When the doshas are in its that same state, it is arogya. It does not cause any harm to us. Whereas if it is going to its utklesha avastha, when it is aggravating, either it is aggravating or it is becoming more shayam. So that time it is a roga. Okay. Next, it is type of roga. निज आगन्तु विभागेन तत्र रोग द्विधा स्मृतः. So we have two types of roga. What are that? Nija and agantu roga. Nija rogas are due to the imbalance of endogenous systems, whereas agantu roga is due to the external factors. So nija may be due to the dosha aggravation, okay, whereas agantu may be due to external things, like you're exposing yourself to any hazardous things, accidents, traumas, injuries. All these things come under agantucha roga, which is happening from external environment, like even the pathogen interaction. All these things is agantucha. Next is roga adhishtana. तेषां कायमानोभेदात् अधिष्ठानमपि द्विधा. So we have two roga adhisthana, kaya and manas. Kaya here is the sharira, okay, and manas is the mind. These are the two adhisthana. So kaya roga only you have nija agantu and all. Manasika rogas we have two, that is rajas and tamas. Next, examination of patient and disease. Roga pariksha and rogi pariksha. Darshanam sparshanam prashnaihi pariksheta cha roginam. Rogam nidanam pragrupa lakshanam upashayapti bihi. So, rogi pariksha has 3 points. Darshanam, sparshanam, prashanam. Darshanam is using your chakshurindriya for inspection. What you see. What can we see? The discolorations. So, like in seeing that, you can just imply some diagnosis on them. So, for on seeing pale skin, you can just tell it is because of, it may be because of anemia. Yellow skin because it may be because of jaundice. Bluish discoloration due to lack of oxygen and such things. Dried up skin may be due to dehydration and hypothyroidism. So, like this, you can inspect. It may be, but you cannot just confirm it. It may be. Next is Sparshana Pariksha. Sparshana is palpitation. You can palpate the temperature, the tenderness, any abnormality, organ enlargement, pulse, and all. Prashna. By asking several relevant questions, you can just talk to the patient. Especially in psychological disorder, Prashna plays a very important and crucial role. So, these are actually a quality, you can say, to interrogate and discuss a case or gather information from your patient. Roga Pariksha. Roga Pariksha is having 5 things. Nidanam, Pragrupa, Lakshana, Upashaya and Anupashaya, Samprapti. So, Nidana is the causative factor. Okay, the one which is causing. So, any treatment begins with Nidana Parivarchana. That means you have to stop the etiological factor which is causing the aggravation of the disease. So, stop that. Next is Pragrupa or Purvarupa, the premonitory symptoms. What is observed? Lakshana is the signs and symptoms what we see. Upashaya and Anupashaya is the aggravating and the relieving factors. Okay, so Upashaya is the one which relieves it. Anupashaya is the one which is aggravating. So by doing this, you can know which treatment is actually good for the patient and actually which dosha involvement is there and what the treatment should be done can be assessed by Upashaya and Anupashaya. Samprapti is the pathogenesis. That is what you conclude from the disease diagnosis. Next is Desha Beda. Bhumi Deha Prabedena Desha Mahuriha Dvida. Jangalam Vata Bhuishtam Anupam tu Kafolbanam Sadharanam Samamalam Trida Bhumi Desha Madishet. So here, as our body is also divided into deshas, that is parts, Bhumi deshas is also divided into three. Jangala, Anupa, Sadharana. So here, Jangalam is actually Vata Bhuishtam, predominant of Vata dosha. Anupam is Kapha predominant dosha. So it will be watery land will be Anupa. Jangala will be dry and arid region. Sadharanam is Samadosha. Here, Acharya has not included Pitta dosha, Pitta Bhuishta Desha. Why? Because in such a region, a person cannot sustain or live. Okay, so that is the reason. Next, coming to Kala Beda. So in Kala Beda, we have Shanadi, Vyadi Avastha cha Kalo Beshajja Yogakrit. So Shanadi and Vyadi Avastha. Shana is the what we say like seconds, like that. We have Shana as the measurement of time in Ayurveda. Vyadi Avastha is we have Shat Kriya Kalas and all, which will be dealt in physiology. So according to that, we have two Vedas. Next is Manodoshas, we have told Di Dhairyatmadi Vijnanam Manodoshaha Aushadam Param. So the Aushada for Manodosha is Di, Dhairya, Atma and Vijnana. Courage, giving courage, self esteem, Atmadi, the one's conscious, and Vijnana, the knowledge, should be there in treatment of Manodoshas. Next is Aushada Beda. Aushada is actually categorized into two. Shodhana Shamanas Cheti Samasad Aushadam Dvida. So Shodhana is of three again. Vasti, Virechana, Vamana. Vasti is for Vata, Virechana for Pitta and Vamana for Kapha. Next is Shamana. Shamana is done by Taila, Grita and Madhu. Again, Taila for Vata, Grita for Pitta, Madhu for Kapha Pradhana Sharira. Next, Pada Chatushtayas. The quadrants of treatment. Bishak Dravyani Upastata Rogi Pada Chatushtayam Chikitsa Tasya Nirdishtam Pratyekam Tat Chaturgunam. So the four Pada Chatushtayas are Bishak, Dravya, Upastata, also called as Paricharaka, and Rogi. Bishak is the doctor, the physician. Dravya is the medicine, also called Aushadam. And Upastata or Paricharaka is the nurse or the bystander, and Rogi is the patient. Now coming to Bishak. Dakshas Tirthartham Shastrartho Drishta Karma Suchir Bishak. So here the word Daksha means an expert. Tirthartha Shastrartha means qualified physician. Drishta Karma, the one who is well experienced. Suchi means hygienic physician should be the qualities of Bishak. Dravya. So, what are the qualities of a dravya, the medicine? Bahukalpa, various kalpanas, that is the formulation, should be possible and various dosage should be available. Bahuguna should be of broad spectrum, like in various activities a single medicine should do. Sampanna, easily available, and yoga, it should be suitable to many patients. Next is Upasthata. Anurakta Suchir Daksho Buddhiman Paricharaka. So here Anurakta is an affectionate one. Suchi means hygienic and Daksha means again the skillful one, and Buddhiman, the one who is having the intelligence of the medicine and the treatment. Next is the Rogi. Adayo Rogi Bishakvasyo Nyapakaha Sattvavanabhi. So initially the first quality told by Acharya is the one who can afford to the treatment. Okay, and then is Bishakvasyo, the one who listens to the doctor's advice, and the one who's having a good memory power. Nyapakaha, he should have some memory to at least tell about himself. Sattvavan api, who is courageous to tackle the treatment procedures. Next, coming to the last part of the session, Sadhya and Asadhya Roga. साध्यो असाध्य इति व्याधिर्दीर्घ तौ तु पुनर्द्विधा सुसाध्यः कृच्छ्रसाध्यश्च याप्यो यश्च अनुपक्रमः. So sadhya rogas are of two types, Shukasadhya and Krichrasadhya. Here Shukasadhya is which is easily curable and Krichrasadhya is curable with effort. Some effort is needed. Like asadhya is incurable diseases. Yapya anupakrama. So yapya, if you take, for example, take diabetes. So that is a lifestyle disease. If once occurred, it cannot be cured, but it can be managed. Anupakrama is an incurable disease, comes under this completely incurable disease. So it is very tough to treat such patients. Now, Shukasadhya. Shukasadhya lakshanas are Sarva Aushadha Kshame Dehe Yunah Pumso Jitatmanah Amarmago Alpa Hetu Agra Rupa Rupo Anupadravaha Atulya Dushya Desha Ritu Prakritihi Pada Sampati Graheshu Anuguneshu Ekadosha Margaha Navaha Sukhaha. So here, body should be able to tolerate the medicine, that is termed Sarva Aushadha Kshame Dehe. Yunaha is a young person. Pumso means a male. Jitatmanaha, the one who is having the control over his own sense organs. So that is actually a important characters of the patient which is required to tackle the things. Amarmago, it should not involve the marmasthanas. Alpahetu, the causative factor involved is weak. Very few Purvarupa, Lakshana and Upadrava should be present. The complications, signs and symptoms should be very less. Then it is Shukasadhya. Atulya Dushya, Desha Ritu Prakriti. When the Dushya, Desha, Ritu Prakriti are not having similar features, means the Desha should be not Vata predominant. Ritu also should not be the Ritu where Vata Prakopa happens, or Prakriti also should not be Vata Prakriti. If all these things are same, then it is complicated to give treatment for such a disease. Next is Pada Sampati. All the four quadrants of treatment should be present. Graheshu Anugineshu, even the stars, that is the nakshatra, should be good, favorable for the patient. Eka dosha margaha, only one dosha, one marga should be involved. Navaha shukaha. It should be newly originated, then it is easily to cure. Next is Krichra Sadhya, curable with difficulty. Shastradi sadhanaha krichraha shankare cha tato gadaha. So here the disease which involves surgical interventions is included here, and it should present the features of Shukasadhya Roga. Next is Yapya. Yapya is the one which could be managed. So Sheshadvad Ayusho Yapyaha Patyabhyasa Dviparyaye. So it can only be managed and cannot be cured rest of his life. The patient should follow the Patya as indicated by the physician. Next is Anupakrama, which is not manageable. So Anupakrama eva statito atyanta viparyaye औत्सुक्यं मोहरतिकृत दृष्टरिष्ट akshanakshanaha. So, with no possible signs of cure, a patient is there. And they say Arishta Lakshanas, the one who is having the Lakshanas of death, we should not treat such persons as they are not manageable, which generates negativity, dissolution, pain features like awaiting death, sensory destructions, and all. Next is Varjya Rogis should never be treated. Means the person who should never be treated. Page actually this is for the safety purpose of the bishop. So let's go through it. One who is kept away by rulers. During the period of Acharyas, we had the kingdoms. So, if a patient treated is an enemy of the ruler, it may indirectly come and affect you too, your practice also. So, that is not ideal to treat such person. One who has enmity with the doctor. So, you may think that okay, he has got some injury or something, I have to treat him with a passion. But might be if the treatment has ended in a negative way, then the blame will come upon you. So, to be on a safer side, just do not treat an enemy who has no treatment equipments. So, the during those days, the rogis are supposed to bring the equipments for treatment. So, the one who is not having the tendency to afford it, they are not to be given treatment. Who is not focused and obedient. So, a patient's main goal should be like he should be focused to us, means he should obey whatever the physician says. So that is important in the treatment. Not only the physician should keep giving the medicines and giving treatments continuously, the rogi also should follow it in a very obedient way for the betterment of the health. Who is about to die, who is anxious, who is in grief, covered, and all. So, about to die, we know that that person is going to die. And like Acharya is telling that why you wanted to put effort on a person who is going to die and who is anxious means they will not have a stable mindset. Okay, so treating them may give complication to us. Who is in grief, who is a coward, so they will be afraid of getting the treatment and the treatment procedures. So it goes like that. So these are the Vajriya Rogis, the one who we should not treat. So that's all for today. The lesson has got over, and the shlokas which I have mentioned in the PPTs are very important. It should be by hearted, and I have prepared this PPT in a notes format, so you can just write as it is under the topics. So thank you for your support. Keep studying, keep reading Samhitas. Have a great day. Thank you.